So, ladies and gentlemen, you have got a little impression from my little institute here in Prim, northwest Germany, and you have seen a little bit about the rooms, and you got the information that I'm practicing here, and I would like to tell you something about the last 20 years. And I'm cooperating already with the Institute of Experimental Medicine, with the Pavlov Institute of Physiology and the Stage-Mechnikov Medical Academy, and we have seen very good results, and we will continue in the future. In this film you will later on see the speech from Professor Radchenko at the International Congress in the 4th of October in the Hotel Esplanade in Berlin, at the Congress of Hepatology and Gastroenterology, where he made a very, very sensational interview into the camera, and this will be used not only in public scientific publications, also in scientific publications, and it's very important to show to the people worldwide that this cooperation, GEROSID, German-Russian cooperation, on the field of immunotherapy, hypothermia and neuroimmunomodulation is successful and can be used in many severe ill patients worldwide. And we fulfill now the demand of the WHO, the World Health Organization, Health for All until the year 2000. And I wish you all the best, and in some minutes you can see the Russian text of Radchenko's speech. Okay, thank you for your attention.
Dear patients and Russian experts, I'm Ruth Heinen from Belgium, a member of the German Benelux patient groups to promote immuno and molecular biology as practiced from Günther Hase. In the name of many patients, I will say who get help from Professor Günther Hase, I say thank to the scientific and clinical approval of Mr. Hase's therapy. I also express our wishes that you must continue your common work to help more patients worldwide. My dear husband, son, daughter and I were freed from sinusitis, bronchitis, asthma, eczema, urogenital infections and problems with the joints. We had these problems for many years. We feel fine now. Thank you for your attention.
Yeah, Mrs. Hein, I say thank you for your nice words to our German-Russian cooperation.
It was a need to me to express my thanks for the German-Russian cooperation, also to continue their important work. Many suffering people need such therapy modalities to overcome their chronic disease. It was a pity for me that in Russia such important clinical and scientific work is usual and not common available in the West. I can't believe it that here these helpful therapies are ignored. Nevertheless, you have helped a lot of patients. Many cases I saw with my own eyes. This was one reason to trust your therapy, and I came with my family in your treatment, and we were cured. This convinced me completely.
Yes, okay. The fields of physiology and immune biology and molecular biology have a long tradition in Russia, and Pavlov and Menshnikov were outstanding scientists, and I am sure that the nowadays Russian experts are of the same level. Our future work will bring a lot more fortune for suffering people. Then I would like to say thank you. It was very nice from you for your nice words. Thank you.
Thank you.
Здесь собрались ведущие ученые со всей Европы.
The International Hepatology and Gastroenterology Congress has been devoted to the hepatic, rectal and pancreatic illnesses. Scientists have gathered from many countries. There are 30 of us from Russia. I am representing the scientists of St. Petersburg working on these topics.
наша делегация из России.
I would like to use the opportunity to report on our results achieved at the Hepatitis Center of the Mechnikov State Medical Academy, where we work on hepatitis C infections. This virus causes serious problems, amongst others, in Africa, the United States, Italy, Canada, China, Japan, and Germany. The established method to cure the infection in these countries is the application of interferon and ribavirin. The efficiency of this preparate is, however, not too high. It is between 50 to 60%. Many scientists are searching worldwide for treatment with increased efficiency against the virus.
Лечение больных хроническим вирусным гепатитом С.
We are aware of the method Professor Hase has developed for the treatment of tumors. He carries out an enormous job at his clinic with very good results. Our institute has a long-standing close cooperation with the clinic of Professor Hase. We have tried his method for the treatment of hepatitis C infections. Patients of a group of 20 infected with type 2 hepatitis C were treated for 6 months with interferon and amino acids. The outcome was very positive. The amino acid treatment was much more efficient. In addition, patients tolerated this treatment better. Besides eradicating the virus, the treatment also allowed for the regeneration of liver cells. The overall quality of the liver improved as well. All these enabled us to submit the documentation of these results to a committee in order to apply for a patent on the application of these substances to cure hepatitis C infections. Thank you.
Professor Ratzinger, I say thank you for the interview and the statement that our clinical and scientific work is very good and has its results. And this is important for the future for all of the world because we have developed a new therapy against hepatitis C. And that's important.
Yes.
Thank you for the interview.
The work will be carried on, and I'm looking forward to further achievements. We have many further interesting ideas. I would like to say thank you to Professor Hase for having introduced these substances to Russia. Professor Shalizova had a crucial role in these achievements by carrying out a precise and thorough study on the composition of this preparation and on its role on the human organism, especially the liver. Our results justify our hopes to be able to use this preparation to cure people in the future. Thank you.
Okay. It's very nice that you talked some words about Natasha Radchenko. Valery Radchenko made the clinical trials with hepatitis C patients, and Natasha Shalizova made the tests in organotypic tissue cultures. And all the testing was brilliant, and we have the best results worldwide.
Im Namen der Patientenorganisation möchte ich den Ostbelgischen Kanal.
My name is Gerhard Kleinhammer. In the name of our Patient Initiative Group, I would like to thank the East Belgian OKTV television channel for having broadcasted a program on the method applied by Günther Hase. It is very important that people all around hear about such methods.
Ich habe inzwischen, das ist 12 Jahre her,
I got larynx carcinoma 12 years ago. I am all right now. I am still treated by Mr. Hase. I am very satisfied with his treatment. When I was investigated at the clinic the last time, a doctor told me that such methods help healing and suggested me to stick to it. I decided for it. And I would like to say thanks again.
Und dass ich doch dabei bleiben sollte. Und so habe ich mich dafür entschieden. Und wie gesagt, nochmal herzliches Dankeschön.
Ich schließe mich den Ausführungen von Herrn Kleinhammer an.
I would like to join in on what was said before. I would like to add my own story to the whole. Professor Hase had freed me from the problems that tortured me for long years, like edemas in my legs and sciatica. And my husband was diagnosed with lung problems due to his work with asbestos. This was also successfully overcome with the help of Professor Hase's method. A few years later, my husband got rectal cancer, which was surgically removed. Unfortunately, there were metastases found in some of the lymphatic glands. Aftercare treatments following surgery were carried out with the method of Günther Hase at his clinic, and since that, my husband's blood values are very good. He has no problems or complaints. And, well, this is in contrast to some patients who've been treated in the so-called traditional way, and many of whom have unfortunately died since.
Mit Chemotherapie und dergleichen und viele davon sind leider schon.
So, both of us feel well, and as we decided to fund a patients initiative group covering many patients from the Benelux states, France and Germany, we would still like to express our gratitude over and over again. We hope that Günther Hase is kept in the